Mental health is gradually gaining the attention it deserves within the health landscape, and this is evident in the increased awareness of mental health and wellness at a personal level, in our communities, and in our places of work. Hello, I'm Bulane Mphatso, and welcome to the Faces of Mental Health. In this episode, I'll be discussing 10 reasons why mental health is important and why it should be prioritized in our communities. Mental health affects us all. If we combine all mental health disorders and disabilities together, we know that 1 in 5 people will experience at least one mental health condition in their lifetime. Mental health conditions can lead to disability. Mental health conditions are more serious than commonly perceived. More than a quarter of the total amount of disability due to health problems in the world is caused by mental disorders and disability. This disability affects a person's ability to do things at home, to embark in school activities, and to find work. Mental health conditions can lead to death. People living with mental health conditions and disability die younger than those without a mental health condition, and this is caused by a variety of factors. It could be suicide, it could be through motor vehicle accidents and driving recklessly under the influence of substances, drugs, and alcohol, and could also be due to unhealthy lifestyles, such as increased use of substances as a way of coping with stressors. Also, in addition, people with mental health disorders tend to get poorer quality of health and poorer quality of medical attention, and this is due to a lack of resources and stigma. Mental health affects other areas of our lives. One person can have more than one mental health condition at the same time. Furthermore, people living with mental health conditions can also suffer from physical conditions, which could lead to the worsening of the physical condition. Mental health conditions can affect people living with the ill person, such as children being raised by caregivers who suffer from severe mental health condition. This will affect their development, their health, and overall functioning. Access challenges of mental health services and resources. There is a shortage of mental health services and resources in most countries, particularly in low and middle income countries. There is a significant shortage of the mental health workforce. The World Health Organization recommends a target of one psychiatrist per 10,000 population. But the reality in some countries is that there is no psychiatrist working in government hospital settings, and the few clinical psychologists within the country work in private practice. This causes a serious gap in the delivery of services to the people who need them the most. Rapidly changing society's impact on our mental health. We live in a society that is rapidly changing. Exposure to unfavorable social, economic, and political factors impact on the functioning of our communities. This in turn affects the social fabric of community living, rural-urban migration, as well as the rapid growth of cities. This in turn impacts on income inequality, violence, substance abuse, and all these factors impact on our mental health. There is a low budget towards mental health globally. The budget allocation towards mental health is low globally. This impacts on the implementation of treatment and services towards mental health needs. The World Health Organization recommends countries to allocate 12% of their national health budget to mental health, but the average expenditure towards mental health globally is a low 2.8%, even lower in low and middle income countries at 0.5%. Risk factors for poor mental health. Poor mental health can arise from a number of factors involving family history, exposure to adverse life events, socioeconomic and political factors, substance abuse, as well as unhealthy lifestyles. Exposure to unfavorable life events, particularly during the critical times of development, such as childhood, pose even a significant impact on development. Poor mental health can be triggered across various settings. Mental health disorders affect several parts of our lives, including the individual, community, school, and work functioning. Therefore, a collaborative effort towards good mental health should be promoted in all community settings. Thank you for watching this video, and please subscribe to the Faces of Mental Health for more content on mental health and wellness.